Hi friends, I am Dr. Rajeshwari Reddy. I am an obstetrician and a gynecologist laparoscopic surgeon with 18 years plus of experience. Today we will be talking about laparoscopic tubal ligation, or popularly called as laparoscopic tubectomy. This is a method of permanent contraception where we completely seal off the tubes. Firstly, let me explain the role of tubes in conception. Following sexual activity, the sperms enter the vagina and move up the uterine cavity into the fallopian tubes. The egg travels from the ovary into the tube. Fertilization takes place in the fallopian tube on either side. When we need contraception, then we choose from several options which block different steps of the cycle which I just explained. There are two types of contraception. Temporary contraception, as in oral contraceptives, injections, intrauterine devices or implants. And then there is a permanent method which is called sterilization. What is the ideal time for sterilization? Ideal time would be soon after following normal delivery, as in within 2 to 3 days after delivery, or intraoperatively during repeat cesarean sections, or if it is an interval tubectomy, then following menstruation. We always ask patients to come after their menstrual cycle because we want to be doubly sure that there is no pregnancy. Let's see what is the procedure of sterilization. One day before the surgery, we ask patients not to have any liquid or solid diet after 10 p.m. So we need 12 hours of nil by mouth before they come for surgery. Patient gets admitted on the day of surgery in the morning. Then a IV line is secured. Anesthesia is required. It could be regional anesthesia or general anesthesia. 3 5 mm incisions are made, one over the umbilical area and 2 on the 2 sides of the abdomen. The umbilical incision is used to introduce the camera so that we can see all the intra-abdominal organs, and one port is used introduced to manipulate the uterus and the tube, and the other port is used to hold the tube and seal the tube. There are 3 ways of ligating a tube. The first one is the Fallop ring, where we take a segment of the tube and put a band over it. This is called Fallop ring. And second one is the clip method, where we put clips to fallopian tubes on both the sides so that they are sealed permanently. And the third one is where we cauterize the tube and cut it so that the 2 ends of the tubes are separated. And then the skin incisions are closed either with a skin glue or with a stapler. The average time of this surgery is about 10 to 12 minutes maximum. Now we will talk about advantages of laparoscopic tubectomy. It is absolutely a bloodless surgery. It is a daycare procedure. Patients resume their normal activity quickly. They can move around within 2 hours of surgery. The recovery is very fast. The pain is very minimal. Patient can have normal food in 2 to 4 hours. There is no catheterization that is required. Patient can get back to their normal routine work the next day. The amount of painkillers and the antibiotics used is very minimal. Laparoscopic tubectomy is a very safe and effective procedure. The failure rate of laparoscopic tubectomy is 0.001%, which is close to 0. And it can also be reversed laparoscopically. Of course, the results are questionable, but in recent times, with the availability of IVF procedures, the demand for reversing the laparoscopic tubal sterilization is considerably reduced. And of course, it does not affect the sexual life, it does not affect the hormonal levels, it does not affect the regularity of the menstrual cycles, it does not reduce the menstrual blood flow, it does not come in the way of routine activities. It does not affect the woman in any which way. So the only thing that people need to be particular when opting for any laparoscopic surgery is the skill and the experience of the surgeon. So laparoscopic tubectomy is a highly effective and safe procedure. Thank you.